Love it when we get a house call. Ding, ding. Who's that? Hello, Astria calling.
That's right.
You know, we have with us today Elizabeth Jensen of the Astria Elizabeth Jensens. I don't know if you're familiar with the family, but long-time pharmacy folks. Just kidding. How long have you been in the pharmacy game?
Since 2020.
2022? So you're relatively new to the field then, aren't you?
Mm-hmm.
All right. We ought to be able to trick her with some questions then. Just kidding. Elizabeth, we're here to talk about Naloxone and other things. Brand name Narcan. We've done countless stories about it. Lance has. He is the newsman to the stars. And so it seems kind of, to me, mysterious that this substance can pull people back from the brink or whatever. But regular people are supposed to, if you're around addicts, if that's part of your family, you're supposed to do that. It's something that the average Joe can use. Tell us how the whole Narcan thing actually works.
Right. So what it does when you administer it is it gets on the receptor that normally opioids would bond to,
right.
Or it knocks that opioid off the receptor and blocks it so that it can't actually act in your body. And so and when a person is having an overdose, you give them Narcan or Naloxone, and then it can reverse that reaction.
What the opiate does, is it a suppressant? I mean, does it like shut off certain aspects of my breathing?
I mean, eventually you stop breathing,
right.
and you become unconscious.
So the Narcan basically says, get out of here, fix that off, and then the negative effects of the opium, they just like cycle through your body and go out if you recover?
Yes, I mean, so Naloxone itself does not act as long in the body as opioids, so that's why often you'll hear people say that they need a second dose, or, some of the opioids we have out there right now need extremely high doses of Narcan.
They're monsters.
Any more than 2 doses. It can be quite extensive. But if that is what's going on, if the person is overdosing and you give them Narcan, you just keep giving it to them until either EMS comes or they fully recover. And sometimes they can kind of rally and then actually
straight back again.
Yeah, so then you just give them another dose.
Gotcha. So what's the delivery system? Is this an injection? Is it
there are systems that are injections.
If somebody's out of it, right? They're not going to be sniffing in or anything. You either can give it IV or IM, or you can give it nasally. What we are dispensing is a nasal formulation, simply because we want the general public to be able to just give it easily. And a lot of people are afraid of needles, and don't want to give it in the wrong area or hit a vein or whatever. So it's just a nasal spray, and it's very easy to administer. So what does a dose of this cost?
I mean, if you had to buy it, our cost when we buy it for hospital use is about $60, $50, and that's like the cheapest we can buy it.
All right, so if someone's supposed to be carrying this because they may have family members or whatever, are they're spending more than that?
No. So we have a program at Astria where we actually have boxes located in our hospital ERs, as well as several of our clinics dispersed throughout the valley, and you can just go up and get one for free.
What?
So
way to go, Astria.
Yeah, right. So, and it's it's a very successful program. We've given away a lot of Narcan since we started it, and I plan to continue to do that.
Is there any issue if someone just says, well, I'm just going to try Narcan on its own, does that have any impact on the body?
No. It's a safe drug. So I know that there's definitely parents get antsy about having drugs in their house that kids can get into or whatever. It's not something
that someone can abuse by using it for some sort of
if you took it, it would just it doesn't have bad side effects. You're just wasting the dose.
Hey, Dave, one of the things you might not realize is that in all of our clinics, we've got that free dispenser of Narcan on the walls. You can walk right into the lobby of the emergency department or right into the lobby of the clinic, and you'll see a sign that says Overdose Kit. It's right by the door, and you can grab the Naloxone, and it's got a brochure in it that tells you how to administer it.
And is that the industry standard, Elizabeth? Is there anything out there that competes with it, just out of curiosity, or
as far as a drug?
Yeah, as far as an effective drug that the public can handle and help get somebody out of trouble.
Yes, that is your option.
So, because I guess maybe better take two. Because of the strength of the stuff that's out there. So
all of the boxes come with 2 dispensers.
Multiple doses? Okay.
Yeah. There are different programs out there. Some of them have like a vending machine or that type of thing. We decided to go very low tech. Because we wanted to be able to get it out quickly to people. When we actually rolled it out the week we rolled it out, we were having a bad batch of fentanyl move through the valley, and we were having several overdoses, and we just decided, you know what, we just have to get it out.
So it's not inconceivable that somebody could run in with a patient in their car to just grab it and bring it to them, right?
Right. So, 100%. We actually have had that happen where a person did that, and then they were actually overdosing in the waiting room because the person brought them in, and we, were just able to go ahead and give them the dose. Obviously, we then pulled them into the ER and worked on them. But yes, that has happened.
So people hear the word fentanyl and associate that. That is a synthetic opiate?
So fentanyl in and of itself is a drug that we use in the hospital.
Right. But painkiller, right?
Right. But there, when you talk about what's on the street, that is more of a synthetic drug that's been dubbed fentanyl, but it's
But this still works on
it works on opioids in general. It just depends on the strength with which the opioid binds to the receptor. That's what affects, and also the amount of time that it stays in the body.
Gotcha.
It affects how much you have to give.
All right, so give us an idea maybe where clinics are located. I know you guys have a ton of clinics.
Sure.
So up and down the valley, where might we find
There's one on Autanum, just right there by Costco.
Okay.
And then we have obviously the Toppenish Hospital. We have a clinic in Toppenish that has them. We have a clinic in Zilla that has them. Just right there by the subway, and right there, just right off the exit. And then in Sunnyside in the ER, and then in our Rapid Care that's right across from the high school in Sunnyside, we have a dispenser. And then we have one in one of our Grandview clinics, Grandview Medical Center, and then Prosser Urgent Care.
Elizabeth Jensen is the pharmacy director for Astria Health. I don't know if we got any questions last. I got one more for you, and that is, because of the effectiveness of this, do we see daredevils say, I've never tried an opiate, but if I've got Narcan with me, I'm going to try it? I mean, is that a sort of gives me permission to experiment? Is there any concern for that?
Yes, obviously that is something that could happen. I guess my feeling is I would rather have them be alive and learn from that very stupid experience versus have them be dead. I think, when we were younger, right, we could maybe experiment with, too much alcohol, and we'd wake up the next day and
You're still younger, but I get your point.
And have a headache and feel stupid, but a lot of these kids are doing this and they're waking up dead. Yeah. And I, as a parent, would rather
run the risk that somebody might do something foolish like that.
I would rather have the option of scolding them later than, standing over their...
Just because you have the antidote don't mean you should play with poisonous snakes, right? I mean, that's kind of what we're talking about. Anything you want to add to this? This is important information for people to know because it's out there, it's everywhere. We hear more about it. It's great to know that...
We definitely do want people to know it's out there. We want it to have, to be an option in somebody's house. I would say... if you have an opioid prescription at all, you should have this in your house.
Well, and we've heard of like police officers just being exposed in a bus situation to succumbing to the effects of this. So
that's actually how we kind of got into this space, is we kept hearing about that. And that was something that, to me, it just didn't ring right. It didn't seem fair. So we actually reached out to Sunnyside Police Department, did some education with them, and donated doses to all of the police and the corrections officers so that they could carry it with them.
Is there an expiration date?
Definitely there is. With what we have going on with Sunnyside and then Toppenish and then Grandview Police Department, we expanded the program. We told them once you get to a point that it expires, just bring it in and we'll swap it out. Having said that, if you're in a situation and your Narcan is expired, I mean, I would certainly, if it was me, I would use it, and then I would try to get something that's not expired. I'm not by any means saying that you should use expired drugs, but
but this has a specific purpose with no normal ill effects of any kind. So if it is expired, you're not putting anybody more at risk. There's a chance that whatever efficacy still has in it might help temporarily in that situation while you go to Plan B or whatever. Elizabeth Jensen, thank you so much for this information. Astria, thank you guys for making this available. We appreciate you coming in, making a house call.